So when you're diagnosed with prostate cancer, no doubt you're going to need a team of people. That team can be 5 people, it can be hundreds of people. But that team consists of a lot of different types of people. And some of the most important parts of this team are physicians, doctors. You already have a urologist. This is the doctor that did your prostate biopsy. He's the one that discussed with you your biopsy results. And this team that we talk about, it's often recommended to get numerous urological opinions. So, getting second and third opinions from other treating urologists is something that is often recommended by many people who discuss prostate cancer. And I can't agree more with that. It's important because each urologist may share something different. They may be able to help uncover areas that you didn't know about. They may be able to talk with you and give you treatment options that you weren't aware of. So getting second and third urological appointments is very important. Urologists, these are doctors that are trained to do surgery. And so many times with a prostate cancer patient, they will recommend surgery. It's not because of any other reason other than most of the time they really believe that surgery is the best treatment option for that patient. Just like radiation doctors are trained in radiation and they truly believe that doing radiation is the best treatment option for that patient. So when you see a urologist, be aware they're likely going to recommend surgery as your treatment option. Other physicians that are on this team, I believe it's important to talk to a radiation oncologist. These are trained doctors that focus on radiation. So they do external beam radiation. They do proton beam therapy. They do brachytherapy. So these are doctors that are trained to give radiation. And again, when you talk to them, you have to be aware that likely whatever area that they specialize in, that's often what they're going to recommend for treatment for your cancer. So take it with a grain of salt. Another type of doctor you may want to consider adding to your team is what's called an oncologist. These are medical cancer doctors that specialize in cancer management of patients. And these are doctors that see treatment failures. They've seen prostate cancer patients for 10 years, 15 years, 20 years, 30 years. They've seen the treatment failures. They've seen patients and they're able to use medicines and other treatment regimens to help, usually in advanced prostate cancer or cancers that have returned after initial treatment or metastatic prostate cancer. It's important to have a urologist or have an oncologist because they're very helpful to the team. Another physician is your primary care physician. This is the doctor that you see on a regular basis. This is the doctor that manages your blood pressure, your diabetes, your heart risk, your cholesterol, all this stuff. It's important to be in tune with this doctor because that doctor is someone that will help you navigate this entire situation. He will have patients that have gone down this road. He'll be able to share with you his opinion. Again, he's focused and is specialized in primary care typically. He's not a specialist, or he or she is not a specialist, but their opinions are very valuable to understanding little bits and pieces about prostate cancer to help you. Ultimately, all of this is there to help you make that decision on what is right for you with regards to your treatment decision for prostate cancer. So physicians takes up a large part of that team. It's important to set these appointments up and be prepared to talk to these doctors and have appointments set up. Make sure you have your records. Make sure the other offices have these records available so that there's no delay. Prostate cancer is one of those unique cancers in that oftentimes when you're diagnosed with prostate cancer, you can wait on treatment for an extended period of time because most cancers are slow growing, low risk, and unlikely to spread in a short period of time. It's not uncommon to take time to really evaluate the possible treatment options and really assemble this team and get numerous opinions from doctors. So again, the goal is that you are doing the treatment that is right for you. So many patients will wait 6 months. Now, if you have an aggressive type of prostate cancer, you have high-risk prostate cancer, high-volume, high-risk prostate cancer, or metastatic prostate cancer, then no, you're not likely someone that just says, hey, let me look at these options and let me take 6 months to figure this out. Because what that will do is allow your prostate cancer to spread and grow and advance even further. So in those subset of patients, it is important to make decisions quickly, to talk to the doctors, come up with a plan quicker than you would. And, in those situations with advanced cancer, the biggest decision is often when you are put on what's called ADT or androgen deprivation treatment. So that's usually the first line treatment for metastatic disease or advanced prostate cancer. So that's something that can be done quickly. So getting back to this team, physicians, they make up a large part of the team. Second is family and friends. These are people we rely on. These are people we trust. These are people that can help us make a decision. There's no doubt. I've always said making a decision for prostate cancer is one of the toughest decisions a man will ever make. And having family and friends as part of the team, I believe, can be very helpful in just helping someone navigate through what is right for them. Support group. There's many support groups, guys that have been through prostate cancer, guys that have already walked this journey that can be very valuable, very helpful in highlighting or helping you make the right decision. And so support groups are very important. They're an important part of this team. A counselor, someone that can help you process mentally what is going on, help you process fear, help you process worry and anxiety that may result in any diagnosis of cancer. So no doubt, a counselor can be helpful. It's available. If you want to talk to someone, if you think it's beneficial to talk to someone, then absolutely add that counselor to this team. This list is not exhaustive. Everyone's team will look different. Everyone will have a different number of people on their team. So that's it. It's important to assemble a team. It's important to get numerous opinions. It's important to talk to many people about your situation. That's it.